Welcome! This guide walks you through the IVF process step by step, so you can understand what happens, why it happens, and what to expect along the way. IVF can feel complex at first, but when you break it down into stages, it becomes much easier to follow. Think of it as a carefully coordinated process designed to support fertilization and early embryo development before pregnancy begins. Let's walk through this journey together. IVF stands for in vitro fertilization. It's a treatment where eggs are fertilized with sperm in a laboratory rather than inside the body. Once fertilization occurs and embryos begin developing, a healthy embryo is placed into the uterus to try to achieve pregnancy. While that may sound highly technical, IVF is really a sequence of coordinated steps involving testing, medications, procedures, and laboratory care. Each phase helps increase the chances of creating healthy embryos and achieving a successful pregnancy. The IVF journey begins with understanding your unique fertility picture. During your consultation, your care team will review your medical history and order several tests. These typically include hormone blood work to evaluate fertility markers, an ultrasound to assess the ovaries and uterus, and often a semen analysis to evaluate sperm health. Together, these results help your physician design a personalized treatment plan tailored to your body and your family building goals. In a typical cycle, the body matures one egg each month. With IVF, medications are used to stimulate the ovaries so multiple eggs can mature at the same time. This increases the chances of creating healthy embryos. You'll take injectable medications for about 8 to 12 days. During this time, you'll have brief monitoring visits so your care team can track how your ovaries are responding and adjust medications if needed. These visits help ensure the process stays safe, effective, and carefully timed. When the eggs are ready, the next step is the egg retrieval. This is a short outpatient procedure that usually takes less than 30 minutes. You'll receive light sedation so you remain comfortable during the procedure. Using ultrasound guidance, the physician carefully retrieves the eggs from the ovaries. Patients go home the same day and recover quickly with mild cramping or bloating that typically resolves within a day or two. After retrieval, the eggs are brought to the embryology laboratory. Here, eggs and sperm are combined so fertilization can occur. In some cases, a technique called ICSI is used, where a single sperm is injected directly into an egg. Over the next 5 to 6 days, embryos grow under carefully monitored conditions. The embryology team observes development closely to identify embryos that continue progressing. Some patients choose genetic testing at this stage to evaluate embryo health before transfer. Once an embryo is selected, the next step is the embryo transfer. This is a quick and gentle procedure where the embryo is placed into the uterus using a thin catheter. Sedation usually isn't needed, and the procedure itself takes only a few minutes. For many patients, this moment feels especially meaningful. It's the point where the embryo is returned to the body and the possibility of pregnancy begins. After the transfer comes the waiting period. You'll typically wait about 9 to 12 days before returning for a blood test that confirms whether pregnancy has occurred. During this time, your care team may prescribe medications that help support implantation and early pregnancy. Once the test results are ready, your care team will call you to discuss the next steps. When you look at IVF as a whole, it's a sequence of coordinated steps: consultation and testing, ovarian stimulation, egg retrieval, embryo development in the lab, embryo transfer, and finally, the pregnancy test. IVF combines advanced science, careful timing, and close collaboration between physicians, embryologists, nurses, and patients. Each phase builds on the one before it. IVF is both a medical process and a personal journey. Along the way, there are decisions, milestones, and moments of hope. Your care team is there to guide you, answer questions, and support you through each stage. Every path to parenthood is different, but understanding the process is often the first step forward. And that journey begins with information, support, and a team that's with you from the very beginning.